Hi, my name is Rebecca Pitts, and this is my persuasive PowerPoint for why you should quit smoking. First, let's talk about the health risks associated with smoking cigarettes. That is a smoker's lung and a healthy lung compared. So, compared to a non smoker, smoking cigarettes increases your risk of heart disease and stroke by 2 to 4 times, your risk of lung cancer by 25 times, your risk of cardiovascular disease, and it damages your blood vessels, even when you smoke less than 5 cigarettes a day. Smokers are 12 to 13 times more likely to die of COPD and exhibit chronic bronchitis, as well as other respiratory and lung diseases. Smoking can also cause cancer in almost every part of the body, including the bladder, esophagus, kidneys, liver, mouth, stomach, etc. The lesser known risks of smoking. You are actually consuming more nicotine than you think. Studies show that between 1997 and 2005, the nicotine levels in cigarettes went up by 11%. Also, light cigarette packs are actually worse for smokers. This is because they pull harder and longer on those than regular cigarettes. This causes the smoker to receive more nicotine than they would from a regular cigarette. You're also losing a lot of money. The average cigarette smoker spends between $3,000 to $4,000 a year buying cigarettes, which adds up to about 25% of some people's yearly income. If a smoker took all the money they spent on cigarettes for 50 years and put it into a savings account, it would add up to about $200,000 to $300,000 extra. The lesser known risks of smoking continued. The effects of cigarettes reduce your blood flow. When you don't receive enough oxygen to your organs, it prevents you from working out to your full potential. The carbon monoxide in your system prevents your muscles from taking in as much oxygen as a non-smoker. This lack of oxygen affects your strength level and diminishes it as well. The chemicals put into cigarettes weaken the immune system. The results are inflammation and cell damage to the lungs. A smoker's body is always trying to fight off the damage done by smoking. This causes the body to be very susceptible to diseases and bacterial infections. The fact that your immune system is weakened also significantly doesn't help either. Someone that smokes a pack a day for a year exposes their body to about 0.36 millivolts of radiation. To compare, to be exposed to that much radiation, you would have to get 72 dental x-rays or go through airport security 3,600 times. Safety experts suggest that you should avoid getting more than 1 millivolt on top of the 3.1 we already receive from the sun and the earth. Adding 0.36 to that doesn't leave much room for the necessary radiation exposure you would get from doctor or dental x-rays. Now let's talk about some alternatives to smoking and stress relief tips. Vaping and electronic cigarettes. Cardio. Creating an exercise routine and following it is very helpful. Studies show that working out reduces your tendency to smoke as well as the likelihood of relapsing. For beginners, exercising even 30 minutes a day is enough. For example, walking outside. Veggies. Munching on fresh fruits and vegetables actually curbs the need to smoke. So keeping a bowl of mixed fruits or vegetables nearby will help keep your mouth busy when you get a craving. Support. Having a couple of people you can talk to for encouragement and to talk you through beating your habit doesn't only take your mind off of it, but it also helps reduce your stress levels. Busy work. Finding a hobby that requires the use of your hands and concentration are great alternatives to smoking. Things such as art projects, wood cutting, cooking, writing, or outdoor sports are perfect ways to busy your hands and put your mind on something besides a cigarette. Those are electronic cigarettes, and that's fruits and vegetables. More alternatives to smoking and stress relief tips. Rewards. Taking a jar and putting $1 in it every time you crave a cigarette is also a good way to help you stop. You can then use the money that you've saved to reward yourself with a pedicure or a nice dinner or a movie or something else that you love to do. Hydration. Start the day with a glass of water when you wake up instead of a cigarette. Studies showed that this healthy alternative helps with proper metabolism and washing the toxins out of your body. Breathing exercises. Not only does this clear up your lungs, but it also reduces stress and helps with the blood pressure. And that's just little jars full of money. And it just says, just breathe. It's a yoga picture. All right. The health benefits to quitting. When you stop smoking, you can enjoy a variety of health benefits. This includes sharper hearing, improved vision, fresher mouth and whiter teeth, clearer skin and the stopping of premature aging, lowers your risk of blood clots, it lowers your risk of cholesterol, or lowers your cholesterol. It prevents further lung damage and emphysema. The air sacs in your lungs start to grow and repair. It lowers your risk for cancers. And it reduces your risk for diabetes. And that just also says that you will feel accomplished. And even 20 minutes after smoking, you can start to feel the effects, and your body starts to show signs of repairing. Up to 15 years after, you can continue to have health benefits. This is some of the benefits from 20 minutes to 15 minutes, or 15 years after you quit. 20 minutes, your heart rate drops to a normal level. In 12 hours, carbon monoxide levels in your blood return to normal. 2 weeks to 3 months later, risk of heart attack starts to drop. Lung function begins to improve. 1 to 9 months after you stop, coughing and shortness of breath decrease. Up to a year after you stop, risk of coronary heart disease is reduced to half that of a smoker. 5 to 15 years after, the risk of stroke is reduced to that of a non-smoker. Your risk of getting cancer of the mouth, throat, or esophagus is half that of a smoker. 10 years after, your risk of dying from lung cancer or getting bladder cancer is about half that of a smoker. Risk of getting cervical cancer or cancer of the larynx, kidneys, or pancreas decrease. And about 15 years after you stop smoking, your risk of coronary heart disease is the same as that of a non-smoker's. Thank you. That was my presentation on why you should quit smoking. I hope you enjoyed it.